Hello everyone, I am Dr. Santosh Trivedi, consultant neurologist at Institute of Neuroscience, Kolkata. On this occasion of World Epilepsy Day, the reason for this talk is to spread awareness about the patient who are suffering from epilepsy. So as we know, epilepsy is a very common disease, and it involves almost every age group from birth till the patient who are elderly at the end stage of their life. So none of the age group has been spared. So regarding epilepsy, which is we should commonly take care about it, do's and don't. So when a patient who suffer from epileptic attack, so it is a very dramatic situation, and everybody who are around the patients and taking care of the patients and their family member, they will develop panic attack, and they at those moment what should we do and not to be done, so they are confused. At those moment it's very important you don't get panic, and you should take care of the patient. And as we know, this is not a contagious disease, it will not spread by touching the patient to the another person. So you should not bother about these things that it will spread when you touch a epileptic patient. And you should take care of patient's surroundings so that he will be at comfort, and there should be nothing, any objects, hard objects that will hit the patient and patient will get injured. So you should take care of patient and their surroundings, make them lie on the one side of the body, so that if their frothing is happening, so it will not go inside the lung, so we can secure the airway. And as we know, the epileptic attack in most of the time will stop in 2 to 5 minutes, and after stopping the patient will regain consciousness. So in the meantime of 2 to 5 minutes, what you should do, you should loosen the tight collar around the neck. You should take off the tie of the patient so that airway can be protected, and there is no need to put any spoon or anything or putting slipper over the nose. So these are of no use. Because of clenching of the patient do suffer from tongue bite, but that will heal with time. So putting a spoon inside the mouth is not at all required. Instead it will damage the teeth, and patient will not get another teeth in future. So this is a measure of least intervention. And when patient regain consciousness, what you can do, you can call ambulance, can go to nearby hospital in emergency department. Sometimes what happen, seizure continue for longer period of time, that we call status epilepticus, and that is a dangerous situation, and you should immediately take those patients to the emergency department. You should call ambulance immediately. You should take the help of nearby police officer, traffic police, and they will help you to reach the nearby hospital at the earliest time. The other thing which is important in the epilepsy patients is that whatever medicine, because epilepsy is multiple types of symptoms, and what commonly known by the patients, what we saw generally, they will have tonic-clonic movement of all four limbs, and that lasts for 2 to 3 minutes. But other than that, there are many different kind of seizures which have subtle symptoms, just like blinking of eye, just like staring, and they will have cut off from the surroundings. So these are subtle symptoms. They will have just jerky movement of the limbs. So these symptoms, subtle symptoms, and these are also epilepsy. And when you go to a neurologist, so by looking at what kind of epilepsy you are suffering from, and you belong to which age group, so we can define what is the epileptic syndrome you are suffering from. And there are many kinds of drugs, almost now 30 anti-seizure medications, and we have to choose the anti-seizure medications depending on which type of seizure the patient is suffering from, and choosing the best molecule for the specific patients help to control the seizure in almost 70% of patients. In rest 30% of patients, sometimes we may require more than one medication, and combining appropriately the another medication at adequate dose help to control seizure in almost up to 90% of patients. In rest 10% of patients who are we call drug resistant epilepsy, so in those 10% of patients we can take another kind of measures like epilepsy surgery. Sometimes we can do vagus nerve stimulation, which can control the seizure in those patients. So this is regarding treatment part. The another important part is that whatever medicine those has been prescribed by your neurophysician, you need to take it regularly, religiously, because missing a single pill can lead to seizure attack. So sometimes what happen, patient well controlled on medication, they think now I am well and good, so they will discontinue medication, and this will end up in very bigger serious attack, and that time even this is sometimes life threatening also. So these things have to be understood. Whatever medication and whatever dose has been prescribed by your neurophysician, you should continue to taking it religiously without missing a single pill. What I generally advise my patient, because this era of technology, we have mobile phone, we can put alarm, and we can for morning dose, for night dose, and with alarm you will not miss your dose, and this will help you to control your seizure. Other than that, the other aspect of epilepsy is that especially in the female patients who are going to get married and planning to extend their family, so they are always worried about what will happen to my child. So in those patients, I would like to say that epilepsy do get inherited, but it is not that simple. There are multiple polygenic transmission. So just saying that you are suffering from epilepsy and your child will get epilepsy, it's not that much easy. It depends on the what kind of gene is there, how much penetrance that gene is having. So it multifactorial. So you should not bother so much about that ki your child is going to inherit epilepsy, and they also worried about the medication and their effect on the child they are going to born. So I will tell that now we have multiple kind of medication, and we have medication which is safe in purview of the child you are going to have. So we have medication which we can prescribe, which could be safely given when you are pregnant. So we can take care of you also and your child also. And regarding some of the myths which are there, that some devil or bhoot pisach which get inside your body, and these cause this dramatic presentation of epilepsy. So these are totally false, and sometimes some wrong practitioner, they use these tricks for their benefit and they misguide you, and this will lead to more hazards then and you will end up in further trouble. So you need right guidance. You should come to neurophysician, neurologist, and we have medication, and with those medication we can take care of your epileptic attack, we can control your epilepsy, and you can have your desired life as you like, just like any other person. So with this I want to stop my message here, and thank you for listening.